Hi, everyone. I'd like to introduce you to Dr. Dian Ginsberg, MD. Diane, could you give a little introduction and background about yourself and how you got into the longevity space?
Sure. I am a OBGYN, board certified in obstetrics, gynecology, and anti-aging medicine. And the anti-aging probably came based on the Women's Health Initiative. I was OBGYN, delivering babies, trying to take care of women. And when I turned about 40 years old, I'm 60 now. When I turned 40 years old, the Women's Health Initiative came through and women just threw their hormones out. For the Premarin was going to give you breast cancer and blood clots. And so there was a small compounding pharmacy near me that was using bioidentical hormones. And he tried to teach me these are different, these are better, they're I hate to use the word natural, but they're more going to hit the receptors in the body. And I played around with that a little bit and then decided I needed to learn more. Googled bioidentical hormone conference. The American Academy of Anti-Aging came up. And I was 40 years old. I went to the meeting and I kind of just got sucked into that functional medicine. That's what it was back then. I learned about vitamin D and the microbiome and things that I probably learned a little bit in medical school, right? You do basic anatomy, you do pathology, and then you spend 2 years figuring out what you want to do. And then for all the years that I delivered babies and did hysterectomies, you really lose the medicine part of it. And I did the whole anti-aging fellowship. And at the time, I also had 2 kids with really bad delayed speech, significant learning differences. My first son didn't talk till he was over 3, and my second son till he was 5. And the second one, they told me he was severely mentally retarded and would never talk. So I brought all the functional medicine back and I gave my patients the bioidentical hormones and I ran all the functional testing and worked on the kids. And my kids started talking, language completely turned around. My big one just graduated medical school. My little one just graduated with his master's. And then I saw my patients start to get better with hormones. And I stayed on that functional testing pathway probably until maybe about 5-6 years ago, as more longevity started to be discussed. You read papers and you start to read about Alzheimer's and Parkinson's and chronic disease, and you realize, wait a minute, maybe there's a step beyond working on the microbiome with supplements. And my mom and dad, I'm an only child, got a little bit older. So it's okay, what can I do to help them? And then I became more and more involved with real longevity. And probably about 6 years ago, I became involved with the young plasma infusions. I'd used a lot of plasma, as you can imagine, red cells and plasma with the OBGYN patients, postpartum bleeding and hysterectomy bleeding. So I'd always been around that. And then all of the studies started to come out with putting in the young factors. And I became involved with Spectrum Plasma, who is a bank in Texas that collects plasma from young adults 18 to 24, and they then infuse it in people for longevity or chronic disease. And I did a study on Parkinson's patients. We worked with 20 Parkinson's patients, 10 got plasma, 10 didn't, and we saw significant improvement in Parkinson's. So that started to drive me in the last bunch of years down the longevity space. And then women were pretty short-sheeted with this Women's Health Initiative study. So I worry in the long run about where the aging menopausal woman is going to be. And so I'm really dedicated now to what can we do to put strategies together. We talk about rectangularizing aging. We don't want to hit 50 and feel terrible and have our bones fall apart and be miserable. So a combination of what is optimal hormonal replacement, what is optimal supplement replacement, and then what can the plasma therapeutics do, A, to prevent chronic disease, especially if you have a predisposition, or B, just to help you really live your best life as long as you can.
Mm-hmm. You have such a unique and interesting background. You're MD, of functional medicine, and then obviously you're taking care of yourself. And then now with the young blood plasma, so many interesting topics to touch. And I hope we get to touch on all, if not most of them. So can you just give an introduction of what is young blood plasma?
So plasma is basically the non-cellular part of the blood, right? We remove the red blood cells, the white cells, you remove the cells, and the plasma is the liquid stuff left behind with all the growth factors. The big concept behind what plasma does, probably no different than when you're hanging it in an operative emergency, right? So if somebody has a car accident, or they have a baby and they have a postpartum hemorrhage where you have to do a hysterectomy because you can't stop the bleeding, right? You're losing factors that are going to keep each organ running. I don't know that that is any different than what longevity is. So in a young person that bleeds, the brain needs these factors, and it needs these red blood cells, and it needs these white blood cells to do its job. So what we do in the hospital, right, is you don't hang whole blood. You put in packed blood cells. Then you put in plasma. If they're not clotting, you put in cryo, like you put in separate factors because they've lost it acutely. The system says, I can't function without it, so you got to put it back in again. Longevity is really the same thing. And it really comes down to, I guess, the split in the longevity community. There are people in the longevity community that don't follow the concept of physics, right? They believe that if you clean enough or you fix the system enough, the system will rejuvenate itself. To me, that doesn't follow the laws of physics, right? The law of thermodynamics. And if you talk about the universe, Stephen Hawking, the brilliant minds will tell you that we are, even though we might be an open system on Earth, we are a closed system when it comes to the universe. So everything is going to eventually go to equilibrium. As you age, your system is going to move in that direction, and you just can't make the molecules that you need to make to keep the system running. And you get to one point where there's just not enough to support it. So as much as you can take supplements or rapamycin or metformin or whatever you feel is optimal for your particular longevity regimen, you have to be the system that continues to run using that. You have to be able to produce that. If physics takes you away from that, then the only way to support it is to give the factor back. It's really the same concept as giving a woman estrogen. So you take a menopausal woman that says, I don't feel good. There's 10 nuclei in your brain that need estrogen to function. Estradiol and estriol. Mitochondria in the brain can't make ATP without estrogen. So what happens in menopause is the brain shrinks. The literature uses the word compensates, but it's a nice word for your brain shrinks. So the nuclei in the brain can do their job with less estrogen. Aging is really the same thing. The system tries to continue to move forward with less efficiency. So what you do to a woman is you give her estrogen back. The brain doesn't care that it's not coming from the ovaries. It's not worried about that. Prediabetes reverses when you give estrogen. The insulin receptors open up more. You get vitamin D and calcium into the bones better. Nobody is saying, hey, that didn't come from the ovaries, I'm not using it. So plasma, young plasma, is the same concept. When you get to a point where you can't make these factors anymore, you can't keep your extracellular matrix and your blood vessels doing what they need to do, so you can't feed the cells. So it didn't matter how many stem cells or signaling exosomes you have. If the exosome signals, it's got to be able to tell the tissue to do something, and the tissue has to have the factor in there that it's going to be able to build. So what the young plasma does is it just dumps those factors back in the same way that a postmenopausal woman puts in estrogen. And I don't think anybody in the body says, hey, I'm not going to use this, I didn't make it. So the ball rolling downhill flattens out more, slows more, stabilizes a lot more. Because also think about it, your reactions when you have all the factors you need become more efficient, right? It's like watching a Kenyan runner run, right? They're perfectly balanced. So they're cost of doing business is much lower. So they burn less ATP. So they're much more efficient in each stride. And that's how they can run their marathon. That's what Kipchoge did, right? When Kipchoge, who was the guy that ran the sub 2-hour marathon, he didn't wake up one day and go, hey, I'm just going to run this, right? They found a special track. They put him in special shoes. They had an arrow like of guys running in front of him to block the wind. They micromanaged every bit of it. So they took the drag off. So he became just a little more efficient in each step. So that's what longevity is. I'm not saying that people that don't donate plasma, or when you do the apheresis, I don't even know that you need to do that. You can go donate for free, but not that you're not getting the garbage out, and it's going to help a little bit because we probably clean a little slower when we're older. But what you're doing is you're taking all those factors that young body can make, and you're just adding it into your system. So therefore your system will run more efficiently. And think about it. If your muscles are a little stronger, you can lift a little heavier. And then your VO2 max will be a little bit better because you can run a little bit better. You'll recover a little bit faster. So the concept behind is to put that in and then use your good diet and your sleep and your exercise on top of it. And that's what's going to give you real longevity. If you're a healthy person, one of the criticisms has been from people is that, and one person specifically said, well, I didn't see a big change in my markers. Okay. Well, if you're somebody that's 45 years old and you're fit, your liver functions are going to be good. Your CBC is going to be good. Your thyroid's going to be good. Your basic lab core markers are going to be fine. So you're not going to put plasma in and go, wow, I notice a difference here. But the big key is, I'm not worried about that at 45. I wasn't worried about that at 45. I ran a 3.5-hour marathon at 47. It's 60. It's 65. It's maintaining health so that you don't get into trouble when you're 60, or you don't get into trouble when you're 70. And I think, do I think it's appropriate to use it if you're 75 or 80 now? Absolutely. Do I think it's appropriate to think about it as you get into your 40s and 50s? Yeah. Again, you're not looking at seeing dramatic changes now, although it's nice to say I feel better and I'm sleeping a little bit better and I feel stronger. What you're really looking for that people don't think about is that when you are in your late 40s and 50s, what's going to happen? Because you will be 70 one day and you will be more fragile. So when we add it, you do a liter or 2 liters, it's really looking at your long-term health.
Okay, so many interesting things to touch on. So can you just explain the process a little bit more, how it works in the context of health and longevity? How does the process of getting a young plasma injection work?
It's no different than you getting a liter of fluid. So you'll same way they would put, say, an IV liter in, you sit, IV goes in, no problem. It's the same same concept. We usually pre-med with a little bit of Pepsid and a little bit of Benadryl just to keep the inflammatory receptors down. You can take about a liter, maybe 1,200 cc's without doing anything else. Usually, if you're going to do 2 liters, some people do the apheresis. They want to do the combo, so they'll take a liter of plasma out or off, and then they'll put 2 liters in. But honestly, you can take like you're donating blood. Most of the time, what we'll do is 600 cc's or 500 cc's of blood out, like you just gave blood to the Red Cross, and then you can put 2 liters in, give your body maybe a day and a half to equilibrate, and then you can put a 3rd liter if you want to do that volume.
Okay, so you're just taking out blood, so you're not taking out plasma, right? You're taking out.
Well, you're taking out everything that probably goes along with it. You just kind of put a needle in and you take 600 cc's of whatever comes out. It's just to make room.
Yep.
You're just making room. So it's because the body, right, can't handle too much. You don't want to overfluid the system. So that's why I said if you're putting a liter in, you don't need to do anything. You can just hang it directly. Some people will do the apheresis. They'll go and they'll say, okay, clean a liter of the old plasma and the garbage out, and then put 2 liters in. And that's perfect. That's sort of a concierge way to put the plasma in, right? You're taking some of the old out. The other thing you can do is you can go to the Red Cross on Tuesday and you can give them, a little bit of plasma, and then you can just go get your new plasma on Thursday. But if you want to do it all at once, like we'll have people where you just sit down, we take 500 cc's of blood out, and then you can just put 2 liters in right after that.
And how long is the process for 2 liters? How long does it take?
It really depends on each person. Some people don't feel, they notice the pressure change a little, so it takes a couple hours. Other people, you can open it up and just put it right in. It takes shorter. It's usually probably a couple hours.
Okay. And for those interested, I know this is a new type of therapy or relatively new. Where can this be done, if it can be done anywhere? Where can
So
people?
right now it's only done in Texas. And the biggest reason is that the FDA will let you ship plasma anywhere you want in the United States if you're going to use it in a hospital to help somebody. If you want to take it for your office, to hang it in your office, they will not let the plasma bank ship it.
Okay.
And their issue is it's a new biologic because it's from adults 18 to 24, which is completely not true because 20% of the entire blood supply is made up of people between 18 and 24. So the FDA has just created this block that won't allow Spectrum Plasma to ship it. Because not only can you use it IV, but we use it in joints. Like I've got a bit of a ripped rotator cuff from my Spartan races, so you get it intramuscular. In here, you wear great results in people that are older, especially, or have knee problems. You put it in the joint area, and you can inject it anywhere there, and it probably gives you about 6-8 months of relief. And then it's growing sort of new factors. It's taking inflammation out of the system. I'm really good friends with Samsan, who is an American Ninja Warrior. He's one of the American Ninja Warrior legends, and he's got a fake knee. He fell off a wall rock climbing, so he's got, shouldn't say fake, he's had like 3 surgeries on it. And the poor guy's been miserable. He's 57 years old. We gave him a shot of the plasma, and he feels like a new guy. He's running again.
Okay. So are you in your clinic accepting patients from all over the world, or?
So I do mostly everything virtual. I don't hang it directly. There's 2 or 3 clinics in Houston that do it, and then if you go to the Young Plasma Study website, the clinics are all listed there. I found hanging that while I was trying to write papers and fight the FDA and all that, I just couldn't be in 3 places at one time. So there's a couple local anti-aging clinics that hang it.
And do you know internationally any sites that are doing this as well?
I don't think so because you can't ship the plasma. So the only way you can do it is you have to now collect it yourself. And there's a lot of stipulations about the bank, like to set up a plasma bank and the testing you have to do, and because they pay the kids get paid in Amazon points or in money for the college bookstore, so they donate, they get money towards their college education, and it also helps them because their system is so young, it rejuvenates. So a lot of people are like, oh, it's blood boy. It's not. It's beneficial. It's no different than that young person going to the Red Cross and saying, I'm going to donate blood. Nobody seems to have a problem with that. But when they donate plasma to be purchased and used to help somebody with Alzheimer's, people have a problem with it. So the rules around it and the ability to ship it is such a problem that the only way you can do it is to set up your own blood bank and get approved by the FDA. And I don't know too many that I know nowhere else in the United States. I don't know in Europe or anywhere else. And I'm pretty sure there's nothing in Mexico either.
Okay. And then I know there were a couple of companies that have been set up in the States a few years ago, and they received some maybe bad press, right, with the whole blood boy and
Correct.
the rich getting taking advantage of the young and the healthy, right, for their own benefit.
Which again, I don't understand. If the Red Cross truck pulls up and they have a blood drive at a college campus to help people at MD Anderson because they use so much blood, why are you not taking advantage of that person? But if you go up to that kid and you say, hey, this person has Alzheimer's, or this person has Parkinson's, or this person wants to really be healthy so you don't have to pay for them, would you donate blood and they in turn reimburse to make your college life buying books easier? Why is that a problem? I don't understand how that's taking advantage. What the other companies did where they got into trouble is the bank and where they were getting the plasma from was a problem. They would say, okay, you're getting young plasma. If you're 60, they would give you plasma of somebody that was 40 saying it's younger than you. So there was a lot of, the company was called Ambrosia, and there was a lot of stuff around it for that reason. Their TV that mocked Blood Void. But again, the blood bank, I live in Houston. MD Anderson, which is the cancer center of the world, people donate blood all the time and donate plasma, and nobody seems to have a problem. And do you know, a huge chunk, I'm sure you do, of medicine is made with plasma. So Bio Life and Bio this, they're paying people to donate their plasma, and then they sell it. And then they sell it to the drug companies that use it to make drugs. Nobody has a problem with that. So I can't understand why, if a young college kid says, hey, I can help the older generation, why wouldn't people be excited about that?
Yeah, I think there's some hypocrisy maybe, and then finger pointing, but I think maybe like it might be company specific, and maybe there's a better way to do this. Have these companies and then make it more equal and fair, and less feeding on the young kind of scope. I think that's possible, and I think hopefully that comes to fruition in the near future, so that this kind of therapy can be taken advantage of by many people.
Well, because if you look, and there was a study we talked about that they took young plasma and estrogen and hung it in rats, and they reversed Alzheimer's. They found that it helped. So there's, right, women are the number one group because of their menopausal changes. Sure, keep us around forever, but kill our estrogen at 50. So, right, paleolithically, that wouldn't happen. You would not be able to have a baby, and then you would die. So now your longevity has taken you to 100, but yet you're going to spend 50 years without estrogen. The system is not meant to do that. So the rats, they're showing, hey, put this and you get better. So for me, plasma's approved. It's rejuvenating. We hang it all the time. The next step is to say, hey, let's start using it. So also, if more people use it, insurance will start to cover it. Prices come down, right? It's like, remember your original iPhone or your original computer or your VCR, all that when it was first out, it was hundreds and thousands of dollars. You get more volume running through, and the kids turn around and say, yeah, I'll help everybody else. And then the plasma bank has more volume. Now all of a sudden prices come down and everybody can benefit from it. But it's a safe therapy that we've been using for years and years and years to keep people alive. We're just repurposing it like they repurpose Botox.
Yeah. Can you talk a little bit about how the young donors are screened?
So one of the biggest, so that it's a typical physical. It's plenty of testing, CBC, chemistry, all kinds of viral checks, hepatitis, syphilis, all that. The girls are also screened for HLA. So the little protein that upregulates should you be pregnant, right, will be a big inflammatory reaction. They're screened for that. So besides all that testing that's done, the plasma is donated, and then it's frozen, and then the donor comes back 30 days later, gets all same thing, completely rescreened, and only when those numbers look reasonable, so a month has shown that they're still healthy, is it released. And then what we try to do, or what they try to do, is then that donor will repetitively give. So therefore, when you receive plasma, you're getting potentially from one, max, hopefully 2 people. So it also decreases the chances that you'll have any kind of real histamine reaction. It's not all mixed together, whereas you get plasma at the hospital, it's just one big vat.
Okay. And then do you see any advantage or need to have additional screening, especially if you're talking about a population of individuals that are very healthy? We're seeing more of these individuals in the longevity space that are testing themselves, all sorts of tests. They're following the right diet, exercise, supplements, and then maybe they want a better screened individual, that doesn't drink, smoke, vape, maybe microplastics, maybe heavy metals. Is there any need for that?
I think that's a really interesting question. And we get the same thing for COVID, because a lot of the kids were vaccinated. So I think that you have to look at it from a balance, right? You have to turn around and say, you walk into Whole Foods and you buy grass-fed beef. Now, what are the chances remember that whole paycheck, there was a big scandal that they weren't grass feeding the cows, and who knows what they were giving them, and then they were selling that. So I think for those individuals, number one, I would say you don't know that your organic stuff is organic. You don't know that your grass-fed beef, where it comes from, unless you buy it from a local farm where you actually know and trust the farmer. And those people are very few and very far between. The pollutants in this. So there's so much bad stuff out here that what's getting piled on your body every day is probably worse than anything you're going to get there. Number one. Number two, what I think you have to come down to is that the body detoxes a lot of that. So if that person has a reasonable C-reactive protein and their liver functions are normal and their platelets are okay and they're making good hemoglobin, you won't have those numbers looking normal if anything in the system was out of whack. We also know about the spike protein from the vaccine. Well, you don't know that even if a kid wasn't vaccinated, that he didn't get COVID and doesn't have the spike protein floating around in him. You also don't know, well, what about, they had hepatitis vaccine or so your question is legit. I think the question of people is legitimate to say, what about all these things? But I think that the body cleans up that mess. If you're healthy enough to have those numbers look normal, then the plasma that's going to come out, what's it going to have, a little vape thing in it? I mean, it's just the liver will have screened it. And so, the liver will have eliminated it. Do I think now you're moving to a level to say, okay, let me find a kid that doesn't smoke, doesn't drink, doesn't this, doesn't that? I think that's unrealistic. It's the same thing. And then you have to take a step back and say, do you have a higher chance of having a complication from that or dying in a car accident? Mm. So there's a balance of what are you looking for? If you're looking to push the envelope of longevity, then you have to take a step back and say, okay, I'm here. I'm going to go to here. I'm adding this in and it's going to help me here. Do I think it's going to help me more here or it's going to drop me lower? The liver is a pretty good toxic waste dump that is going to pick up almost everything. And again, as long as that guy's working, the labs that we check are going to be fine.
Yeah, great answer. Okay, so let's go into the recipient side. So you mentioned this a little bit. You've been obviously testing this in disease context and obviously in terms of aging as well. So what is right now, given that we're still in the infancy with this, what is the ideal donor? Sorry, yeah, the recipient, not the
recipient.
Donor.
I think it's, so would I get it if I was 35? Probably not. Would I get it if I was 35, 36, which I gave to one of the guys in our gym who was a football player and has a horrible shoulder? He's 36. Yeah, I think it's reasonable to inject his joint then because he's not 22. So I think anybody that's kind of in their mid-late 30s and up with any kind of joint problems, PRP is not going to work as well, right? Why do I want my old stuff put back in? And you're talking to an athlete. I've had more PRP in me than you can imagine. But I did it when I was 50. I want my 50-year-old platelets. And the literature will tell you that when you crack the platelets open of a 50-year-old, the growth factors are significantly less than if you crack the platelets open of somebody 30. So I think it replaces PRP for anybody that's getting any kind of joint injection. Period. No questions asked. This is from a micro putting it in. I think instead of just poking on the face with PRP or just poking on your face to do a facial for cosmetics, I think you, without a doubt, you put the growth factors in. Hair growth, same thing, right? You put growth factors in. So for a local, I think anybody mid-30s or 40s with joint problems or anything like that, without a doubt, it works. The IV, I think you're probably good to start mid-40s. Let's say you have a horrible Alzheimer's, again, history in your family. Let's say you carry the ApoE4 double gene and you have Alzheimer's in your family and you know that as you get older, your microbiome diversity goes down. And so you're going to get more inflammation and that's going to lead to links and problems. So I think it's reasonable to start mid-40s. I think it's reasonable for somebody that's in their late 40s, early 50s to do a couple liters a year just to say, hey, I want to maintain my longevity. I'm at 60. That's what I do. I don't really have any medical problems. I don't think I don't take anything. And so I do it because I want to stay fit. When did I start? 4 years ago, 5 years ago, something like that. So what was I, 55? It was more, I'm going to get the infusion because I know my system can't put itself back together where it used to. And so I think anybody that's in their late 40s, early 50s, I think can benefit from just prophylactic improvement. And there are some people that do 200 cc's every few months. I mean, that's part of a study that we're doing, right? We're trying to look and say, it's sort of this open-ended observational study, right? We've got maybe 40 docs that are using it in Houston and surrounding areas, Austin and Dallas, and saying, hey, how are your patients doing? And then this doc may check this, and this one looks at this, and this one says, hey, I'm going to go to, like my dad is a real strong guy. He's 82 years old. He broke the grip strength thing before even the plasma. So you can't measure grip strength on that guy. He's so strong. At 82, he climbs the roof. So I think each individual physician or practitioner will be able to go, wow, I'm noticing this. One of the big things I'm trying to push more a little bit is that the rats showed significant improvement in microbiome diversity. The number one thing, right, in longevity is you lose microbiome diversity. Right. And the microbiologists will tell you the number one thing is keeping it diverse. Well, the rats got a more diverse microbiome. So we're starting to do GI maps or any kind of microbiome testing to show diversity increase. So I think a recipient is going to be anybody that either has any kind of predisposition to issues or somebody that really just wants to take control of their longevity young.
Okay. And then in terms of safety, you said this has obviously plasma has been used for decades, but repeated plasma injections, maybe not so much. So any safety concerns that you've seen or even symptoms?
The only issue we can see is that you can generate a little bit of a histamine reaction. That's why we give the Benadryl and the Pepcid prophylactically. But other than that's it. In other words, if there's something that you have a little bit of a response to, a couple whelps, or a little inflammatory red, a little bit of an itch, usually you slow it down, you give somebody another hit of Benadryl, they do fine. It's just an immediate reaction. They're pretty few and pretty far between. Some of the older studies that are in there that people quote, like the study that Kiproff did that said plasma is a problem, I had all these negative reactions. The study was, I don't know, back in the 70s in California when HIV was so popular. I mean, you got to be careful. You really got to read the studies. Plasma has gotten a bad rap from people that push that want to say, no, the answer is that you just have to keep cleaning the blood. I struggle with that logic because if I could keep cleaning things, I wouldn't have to buy a new car. I could clean it over and over again and it wouldn't eventually fall apart. So I can't follow that, but it is those people that then tend to push more that you're going to get negative reactions. And if you really just break it down, it doesn't happen. And you can look at the blood banks, right? You can look at the national reports. And when they bring up trolley, which is overflow, right, in the lung or an overload, that's when you're pouring blood and plasma into somebody in a trauma. So the real only negative reaction is a little bit of a histamine reaction that a handful of people get.
Okay. And then what about how much does it run to do a plasma infusion at one of these anti-aging clinics?
So it really varies on how much you get. The plasma now is about maybe $1,200 for 200 cc's. And then the doc has to tag on a little bit just for their time.
Right.
Right. They've got to pay for their overhead and this and that. So, but they tend to package it together. So it varies. But that's why I said we've been fighting to try to get it approved by Medicare. Fighting to try to get the insurance companies to say, hey, if you approve this, you're going to put less people in the hospital. I did a small Parkinson's study. I tried to get it into aging and some of the journals. No, your study's too small. Well, I'm a practitioner, right? I'm a clinician. I'm not a PhD or I'm not an MD at Stanford that has a big lab that's got, a $500 million grant that we can do that. We're trying to do stuff in the practical world and then push it forward. And then there's just a lot of red tape. So that's why I said the more we can get the word out there and people get better and they do it, the more volume you run through, the more the prices come down.
Right. Yeah, like anything, that's how it works, right? More volume, usually price decreases. And then, so can you just highlight maybe a few of the outlier cases that you've seen? You mentioned your father has seen remarkable results with this. Any other, maybe disease or health
Now,
related?
macular degeneration. So a woman who's a nurse, transplant nurse, 72, 73 years old, had macular degeneration for probably about 15 years, was getting shots in her eyes every 4 weeks, got 2 liters one day off, the third liter the next day, and went back and no shots for maybe 4 or 5 months. And now they're spread out to like every 6 to 8 weeks. So huge for macular degeneration, which makes sense, right? Blood supply.
Mm-hmm.
It's all about microvasculature. The Parkinson's, again, a bunch of people in our Parkinson's study significantly improved. A lot of autoimmune inflammatory things go down, non-specific like rheumatoid arthritis, back pain, like back degeneration, feeling a lot better, a lot stronger. Trying to think. Besides just everything, like I'm sleeping better and my focus feels better and my energy's better. Like you get a lot of that overall. We're using a little bit with ALS. Haven't seen a ton with that. We've got maybe about 10 patients that have used that. They've kind of just started there. A big thing we're noticing, big thing, is a reversal in hemoglobin A1C. It works on diabetes, prediabetes, because I think it's blood flow. I think it's blood flow to muscle. We had a patient who had a couple people, hemoglobin A1C, older people, 8.5, 9.5, 2 liters of plasma. Within 2 to 3 months, the hemoglobin A1C was down to 6, no other changes.
Mm-hmm.
So it's, I think, again, what we're seeing more there is you open up the blood supply. So therefore you improve tissue vascularity. So you improve burn, you improve extracellular matrix and cellular burn.
And how long does it effect last? Did you measure that?
I think so the hemoglobin, the macular degeneration, she's minimizing on her shots and she's out a year. So that's lasting. The Parkinson's stuff we're seeing probably about a year last. The hemoglobin A1C, I think he's at 6 or 8 months now, and his numbers are still fine. There's a lot of individual stuff, like a lady that had end stage lymphoma, and everything was a mess, and the docs couldn't do anything else, and she got 3 liters, and her counts have stabilized, and her she was more in an end stage, like they blasted her so bad with chemo that she couldn't do anything else and was feeling terrible. Now she's feeling healthier again. Like the lymphoma's not back, but yet her numbers for her own health are coming back. So it's a lot of individual cases that come in and said, man, I'm at the end of my rope. I'm just, there's nothing else that's working. And I've had various different things, and you hang plasma. And again, you rejuvenate the system so they feel better. Their functionality comes back.
Yeah, so much promise. I've been loosely following the studies, and I'm definitely going to follow your studies and your research, and I'm looking forward to seeing more come out on plasma exchange and infusions.
It would be really nice if the bigger institutions would do more, because there's more money in it, right? They have more funding than individual people. And because in order to really do a study, right, you have to have a coordinating nurse, and you have to check this, and you have to have the statistics guy, and that requires a lot of funding. And individual practice people, man, they don't know whether we're coming or going, right? You're answering an email, and this person's hormones are a problem, and hang this plasma, and that's the day-to-day, right, of a doc. Mm-hmm. So the big thing that would be nice would be if the bigger institutions would get away from the animals and start doing that, because then you could really have data. So we're accumulating what we can, but we're just doing it at the pace of a clinician.
Mm-hmm. Yeah, I think it's going to come eventually, but we're rounding up the hour there, so I don't want to take too much of your time, more of your time. I do want to, maybe we can touch base another time. I do want to talk more about specific markers that you've seen improved, and possibly different sources that could come down the line. for instead of young individuals, maybe different sources of this young blood plasma that could come. But maybe we'll leave that for a part 2 down the road. But in the last couple minutes, is there anything you'd like to say where people can find you, where people can follow you, where people can learn more about this young plasma?
So youngplasmastudy.com has tons of info. It's basic info on each breakdown. So in other words, on how it affects joints, how it affects the brain, how it affects. So we tried to break it down to each individual kind of organ system, how it helps, why collagen can't repair and why the factors help. And everything is PubMed quoted. The talk I did on RadFest is there. So there's a lot of data from that. And every time there's a new study, we're adding it in. So microbiome got better, or like I said, the estrogen Alzheimer's got better. So every time there's something new out there, they used it. I saw even like they're doing PRP injections in the ovaries. They used young plasma with men to help sperm count. So on the youngplasmastudy.com, all the data is there. We're trying to upload it as much as we can.
Fantastic. Well, once again, thank you for this, and best of luck with the Boston Marathon.
Thanks. We'll keep everybody posted.
Sounds good. Take care.